Hello, beauties. Hello, gals. How you doing? I'm Dr. Johnson, your host, and welcome to the Gorgeous Glow Skin Show. If you'd like to share this broadcast, just press the share button at the bottom of your screen. Sharing is caring. And if you think a friend would like to hear this message, tag them. I'm in Indianapolis. We just had a pour down earlier, but it's just a little muggy and humid right now, but all is well. Welcome, welcome, welcome to the Gorgeous Glow Skin Show. I'm your host, Dr. Sonia Johnson. I'm a board-certified dermatologist and national speaker. I help women who have problems with their skin with the use of my products and lectures. After listening to my lectures and using my products, they will develop even and clear skin tone with increased confidence. If you think that's you, follow me on facebook.com/Dr. Sonia Johnson, DrSonyaJohnson. Today we're talking about part 2, how the psyche affects your skin. Last week we mentioned the 3 psychodermatological disorders, and today we're going to talk a little more about what are those, how those affect the skin and causes intense psychological problems for people. Well, number one, the skin is a complex organ and it's the largest organ on the body. So when a person has a skin disorder, it's obvious to onlookers, unlike a person who has diabetes or high blood pressure. Number two, a person may have the effects of the skin problems does not correlate with their psychological effect. And number 3 is unpredictable. They can have a flare of the eczema or psoriasis and have no control over it whatsoever. And all 3 of those can lead to a feeling of helplessness as well as not able to control the situation. So what we also notice with people is, like I stated earlier, sometimes the psychological effects does not correlate with the dermatological problem they're having. And what I mean by that is a person can have nodular cystic acne in which they have big nodules and cysts on their face, and they're of course not happy about it, but they're not psychologically distressed over it, whereas a person can have one zit and they're trying to commit suicide. So is that you? And so you have to ask yourself, let me try to get this in control, the situation and my reaction to it. But what we also notice is people, when you ask them how they feel about their skin disorders, they'll tell you how they feel helpless. They have lower self-esteem, lower confidence. They may feel anxiety or depression over it. And about half reported that they avoid face-to-face contact. So what we've noticed is when you have skin problems and you're really upset over it, that creates a vicious cycle, meaning you're depressed, you have more acne, and that causes even more depression, and it makes this vicious cycle. But the beauty of it is, if you control the psychological response to that, you can actually improve the skin disorder. Any questions? Well, great. Again, this is the Gorgeous Glow Skin Show. Next week, we're going to talk about part 3, how the psyche affects your skin. I'm your host, Dr. Sonia Johnson. I'm a board-certified dermatologist as well as national speaker. I help women who have problems with their skin tone and with the use of my products and lectures. And after listening to my lectures and using my products, they would develop even and clear skin tone with increased confidence. Follow me on facebook.com/Dr. Sonia Johnson, DrSonyaJohnson.